How does transverse myelitis relate to MS? Have you ever wondered how transverse myelitis connects to multiple sclerosis? Transverse myelitis is an inflammatory condition that impacts the spinal cord. It causes inflammation and damage to myelin, which is the protective covering of nerve fibers. This disruption affects communication between nerve cells in the spinal cord and the rest of the body. Symptoms can include back pain, weakness, sensory issues, paralysis, and even loss of bowel and bladder control. Transverse myelitis typically involves inflammation across both sides of a cross-section of the spinal cord. However, there is a form called partial myelitis that affects only one side. On the other hand, multiple sclerosis is a chronic autoimmune disease where the immune system mistakenly attacks myelin in the central nervous system. This includes the brain, optic nerves, and spinal cord. Multiple sclerosis leads to inflammation and damage in various areas, resulting in a wide range of neurological symptoms that can vary in severity and location. The connection between transverse myelitis and multiple sclerosis lies in their shared mechanism of immune-mediated myelin damage and inflammation. Transverse myelitis can occur as a one-time isolated event or as an early symptom of multiple sclerosis or other autoimmune diseases affecting the nervous system. Notably, partial myelitis is more commonly linked with multiple sclerosis. If someone experiences transverse myelitis, they may have an increased risk of developing multiple sclerosis later, especially if they have subsequent inflammatory attacks in other parts of the central nervous system. Unlike transverse myelitis, which is limited to the spinal cord, multiple sclerosis affects multiple regions within the brain and spinal cord. This distinction means that while some symptoms may overlap, multiple sclerosis generally presents with a broader range of neurological impairments. Diagnosing multiple sclerosis in someone who has had transverse myelitis requires careful neurological evaluation and imaging to identify lesions beyond the spinal cord. Treatment for transverse myelitis often includes anti-inflammatory medications to reduce spinal cord inflammation. Many patients experience partial or full recovery from the initial attack. However, if transverse myelitis is part of multiple sclerosis, ongoing disease-modifying therapies are used to manage the condition and reduce further neurological damage. In summary, transverse myelitis can be an isolated inflammatory spinal cord condition or a sign of multiple sclerosis. Both conditions share the underlying immune-mediated myelin damage, but transverse myelitis is confined to the spinal cord, while multiple sclerosis affects multiple areas of the central nervous system. Transverse myelitis may serve as an early warning sign of multiple sclerosis, making thorough evaluation and monitoring essential. Always consult a healthcare professional for personalized advice and treatment options.